much. So maybe could you just like introduce yourself? Like, what do you do? And like,
Okay, I'm Dr. Rajiv Gupta. I'm Director and CEO of Institute of Mental Health, Haryana. Right.
okay, what do you do on like a daily like basis?
Delhi, we have a big hospital here. You can't go around the institute. We have acute indoor services, outdoor services. Then we have community projects. We have de-addiction center here, and we are having a geriatric center. We are having a child and adolescent psychiatric center also, and we have a institute where we look for patients admitted under Mental Health Care Act.
Okay, and what was like the process for you to become a doctor?
Hmm?
What was like the process for you to become a doctor?
Process. Okay, that's a different kind. After uh, after school or graduating from a school, there is a test which is called NEET test, which you must be seeing in the papers now. That's the All India test where the students appear for NEET test, and then if they catch up the cutoff score, then they are admitted into the medical school. And medical school is a 4.5 years course with 1 year internship, and then they become doctors or MBBS, what they call. And after that, they can choose a subject in post graduation, and then they become specialist doctors. And after that, they can choose super specialization, for example, DM, which is available in few subjects. Then they can choose that. So it's a long course, starting from say 10 plus 2 years of schooling. Then there is a 4.5 years, then there is 3 years, and then so on.
So did you specialize in like psychiatry?
Psychiatry is a specialization which you require for serving in mental health.
Okay. So what like mental health? Do you see like a stigma against mental health?
Yeah, that's
in
there.
India?
Stigma is there, but now it's coming down. Now stigma is everywhere. It's not only in India we are seeing stigma. Stigma is all over the world because of various factors. But now, because people are now, we are having good treatment available. Earlier there was no treatment, so stigma was more. But now we have very effective treatments available, so stigma is going down.
And what do you still like see it now, and like are there things that you're doing to like get help, like remove the stigma or anything like
Yeah,
that?
we do a lot of campaigns to educate people about mental health, and then that's the main thing. And when the society becomes aware, now people are coming in for having consultation regarding mental health at a very early stage. For example, there is some stress at home, or even at a very early stage, child is getting some stress in the school. The school identify, and the people are referred to mental health. So not earlier. Earlier, people were keeping it a very secret, that they don't want to bring their child if they is having a psychotic problem. They will not bring him out. Or so the duration of untreated mental illness was very long. But now people are coming very early, quite early. So yes, that there is a big change in that.
Are you seeing any like farmers as like patients or?
Farmers, yeah, that is a big issue in India, farmer suicide and all that, because that is not exactly related with mental health. That is related with more of policies of the government, and they are not supporting them enough. So if their whole sometimes our agriculture is dependent on rain and all that. Sometimes so whole of their crop gets washed out, or so that the stress. So that is realistic suicide, where they can't cope up with the life because of poverty or because of their whole economics. So mental health is not directly, I can say that is the major issue. It's more of the real life situations which are not taken care of by the government, and that there. But yes, it's a big issue.
What do you mean like not taken care of?
Yeah, there are policies of the government. You know, we have a farmers' protest which went on for more than 1 year in India. If you are aware of Indian news, so you must have followed that farmers. There was a huge farmer protest which lasted for more than 1 year and still is going on. And they blocked whole of the roads, and few farmers died also during that protest. So that is because there is no economic or financial support which they want, or they take loans and they cannot pay back their loans, and that's something which creates problems.
So what would you say is like the demographic of the patients you see?
Demographics of
Like the patients you see, like most.
demographics, it's both, it cuts across all the age groups, one thing, and across all the socio-demographic profile. We get patients from a very high socio-economic strata to lower socio-economic strata. And age groups, we start getting very early now, and it goes on from early childhood problems and adolescent problems and adult problems, geriatric problems, sexual problems, substance and drug abuse. So there's the whole range of problem cutting across the whole entire age span of human, and across all socio-demographic strata. And of course, urban-rural divide also is very important, that most of the psychiatric centers are available in urban areas, so rural areas are quite deprived. But still they are taken care of by now. We are having good psychiatric services downstream also.
So like the psychiatric services are expanding to more
Rural areas, yeah. Now we have PSC level, CSC level, we are having good amount of work, and we are integrating the mental health services into the primary health services which are available there.
So how do you think like farmers who don't have access like right now, or maybe they don't have like psychiatric services?
That is not, I already told you, that is not directly related with mental health issues. The farmer suicide is not directly related with mental health issues. It is more of a policy issue, or more of the real lifestyle situations where patient cannot cope up because of financial reasons, or because of no occupation, no productive occupation. So that's a different story.
But if they feel like maybe they have some mental health issue, or like
that is taken care of, their mental health issues, and even we are actively negotiating or taking care of those issues where they are having poor coping abilities, or there are family mental health problems that are taken care of. But that is not the only reason why they commit suicide.
What about the families of the farmers who commit suicide? They must need some services.
Yeah, they need services, and we provide them good amount of support and services. And if you but it's difficult. We don't have that much of mental health teams and structure available. That is, so which can take care of the entire needs and the quality services and support what they need. We have very less number of psychiatric social workers and clinical psychologists and nurses which are required for such that. We have lay counselors which we use at the primary health services. They can talk to the families and identify the problem. If they find that there is a underlying psychiatric problem, they refer the Anganwadi workers and those grassroots workers who are trained in screening mental health problems. If, for example, in schools also we have counselors and psychologists posted there who can screen the students and identify those who are having mental health problems at a very early age, and that referral system works. But still it's not very adequate and very comprehensive.
So is there like a shortage of doctors, or are there any like main problems that like this like psychiatry is experiencing right now?
That is almost with every field. It's not only psychiatrists.
Yeah.
The overall doctor the number of doctors and the number of services which are required are less, and that is even in the developed countries also. Even
Yeah.
US, UK, they are suffering from acute shortage of doctors and health services. There are long waiting periods. But in India, that is not very, problematic, because here the system is not working like we have a different life system. So availability is easy here. It's not very legalistic framework for mental health or healthcare delivery. So that is one reason where even a common man can access health very quickly, and the problems are addressed quickly. But still, it's not. We need a lot of doctors and lot of infrastructure to meet with the quality care, so which is definitely a problem. But it is across the entire world. It's not India, because of maybe different reasons, but across the world there is a health systems are working very marginally and very difficulty.
If someone like can't afford to get like mental health care, how can they like seek help?
They can directly walk in to a hospital. For example, if you want to see me, you can just walk in, make a card, and you can directly come to OPD, and a doctor will see you.
Will the wait times be long?
Waiting period is not much. You can just register today, and you will be seen screened today only. And if it is, if you need help, that will be given immediately. But if you need a specialized help, that will take some time. For example, some time may be there, but immediately you will be screened and taken care of your immediate problem.
And do you think that the government has like been prioritizing mental health more lately, or do you think like there still needs?
No, the private psychiatry is moving up, and we have there is no restriction from the government side, and because government setups are already full. For example, that the job is concerned. So now everyone is moving out in practice private. So we have more private psychiatric organizations now, more private hospitals. And the government hospitals alone cannot cope up with the demands of healthcare. So private setup is definitely growing, and very rapidly. And even government setup now, if you see the medical colleges, they are also opening up very at a very district level. They are planning to have a medical college, which is going on, and every state has more than now 10, 12 medical colleges, which is not required. Because, but yes, private setup in India is becoming quite good now, and every small city we will find practitioners who will take care of that.
Dr. Gupta, to say America has a lot of problem with addiction. So there's opioid use in America, which is like really high, because of which there are a lot of mental issues. What is the biggest thing that you're seeing in India?
Equally, India, we have a state where you were, there is a state drug dependence. We have that center here. In India, addiction problems are quite high, especially in Punjab and bordering areas, because the opiates are very high, and even in urban areas, for example, metropolitan areas like Gurgaon, Delhi, you will find lot of cocaine and every type of a drug, even synthetic drugs are available. So this problem is going very high now, and it's very difficult to manage this problem, because of we don't have any control of the supply of the drug, which has a total drug mafia which is operating. Though we have a narcotics control bureau and there are a lot of legal machinery, but still it's very difficult to control the check, because, and even Western countries, despite all those things, drugs are sneaked in, they are smuggled, and there's a huge black market of drugs.
But what about just depression, rise of depression, because of families are becoming smaller. Earlier on you could share with family members your problems. Now it's hard for people to share with each other.
Yeah, that's very important change which the society is undergoing, and adding fuel to the fire is this digital world, which again isolates you, because we are having digitally you may have 1 million Facebook friends or WhatsApp friends, but they are not of actual help.
Yeah.
And there is a validation which is required by you through the social media, because you will put something on media and then you want that there should be good amount of responses. If you don't get responses, you feel depressed. I had one patient, a young girl, who came, and they were not identifying why she was getting depressed into it. And later on intense interviewing, she told me that when she posts something, then she either is trolled or she gets no response which her friends are getting. So that is a hidden thing which is going on. And another thing which is important is that people are depending too much time in this screen time. For example, families you are talking, husband is on screen, you are on screen, children, everyone is glued to their screen, and there is no communication, direct communication. We are losing the skill of communication. Earlier, when you have a face-to-face communication, you can see the nuances, that you are tearful or you are not stressed. You are stressed, and so that communicate. Here you are not available to. You don't now understand what actually you can say whatever in your mobile phone, that I am here. You may lie, or you of situations when you can conceal your emotions, or you can. So that is the biggest challenge now, that this digital addiction, digital world, which is making you more and more living in a virtual space, and you are having less and real time interactions or real time support which is required. Because if you are depressed, you may you write to your hundred of friends, but nobody is there to help you. Everyone is very kind. So that change is again a whole lot of mental health problems which are coming because of this problem, which we don't have enough solutions for that.
Do you think that there's like more mental health problems for like rural workers or maybe people who aren't as?
No, it's not like that. Rural setups have their own advantages also.
Yes.
So it's not that rural people are, deprived people. We are doing a whole work in the rural setups, and there is a good amount of life which they have. There is a good, pollution is less. They are more knitted societies. They can take care of each other's needs more acutely, rather than urban setups where people are living totally isolated. You don't know next door neighbor if even he's died and he's in putrefaction state. Nobody knows that he's died, because nobody is interacting. There is no support, no connection. But rural communities are still well connected.
Yeah.
There are 20 houses, at least they know each other. They will come for support immediately.
There's more communal.
And they celebrate together. They will have festivals together. They have small functions together. But in urban areas, have you ever seen people coming? There is a very artificial set of interactions. They will not. So there is they lack spontaneity. They lack real share of emotions or real support which they need. And that is the big change which is occurring, and we are all seeing that. It's not new. Right? And anything else you want?
I don't think so.
No, this was really helpful.
Thank you so
That's
much.
good. Thank you so much. Okay.